The people here are some of the most genuine people you'll ever meet. For me, I really fell in love with oncology here at UH. I knew that coming back here would be a good choice for me.
This is a very exciting time to be in this field. There are a number of scientists here and more coming that will allow us to develop novel therapies. This institution has a lot to offer.
Part of the way we've tried to design our program, I think, is to be adaptable. It's ultimately up to the fellow to decide what role that they want to do.
You are not alone in your training at the university hospital. You are going to have always your mentors and your leadership helping you moving forward.
I think the goal of a mentor or an attending is make it possible for your fellow to feel at ease.
The mentorship has been one of the most wonderful experiences I've had up and through my academic training. I look at a lot of the faculty, and especially in my co-fellows as well, as extensions of my own family. Everyone, is looking to help each other succeed, which I think is really, really special.
We are very hands-on, so if you love procedures, you have the opportunity to do as much as you want, and the learning never stops in our program.
Fellows carry a lot of responsibility, especially in their continuity clinic. And they learn how to make decisions regarding patient care. Really, the fellows get the first discussion of how to treat the patients and learning how to talk with patients.
They are passionate treating patients. And I love that because I feel that that's one of the best parts that I can share from the university hospital.
The attending physicians want to work with the fellows to educate and bring out the next generation. They were so invested in me, in our collaborative projects together.
Our mission remains the same for all of us. We want to eradicate cancer from Earth. And I think the ability for us to make an impact in patients' life and their families is something that we all actually work for every day.
One of the things about this fellowship that makes it special is it's at 3 different sites. We spend more than half our time at the university hospitals, which is part of our Case Comprehensive Cancer Center. And then we also spend time at the Department of Veteran Affairs site, and then also at the Metro Health site, which is the Safety Net Hospital in Cleveland.
At the VA and Metro, that's where we do our continuity clinics, where we have our own clinics that we manage. And I think that's such a great part of our program where we can really learn and live and grow with these patients that we see throughout the years that we're here, rather than just seeing them once and not seeing them again.
The VA is a fellow-run clinic. These are all the fellows' patients. They see the patient, they make the diagnosis, they make a treatment plan, and we're here to support the fellows, which is something that's very unique about the VA, and it's incredibly rewarding. The patients are very unique in that they are very medically complex. And they're veterans, they've served our country, they dedicated their lives to our country.
Metro Health, being a county hospital, sees everyone, which is a very good thing because you don't just see the rich or the poor, you have a mixture, and that's exactly how medicine should be. That's the taste that Metro Health gives to our fellows. We see patients from early stage and really late stages, and so it prepares the fellows to be ready for life when they graduate.
We've tried to structure our rotations such that all fellows will complete their core clinical requirements by the time they're 2 years into fellowship. And a majority of their 3rd year can actually be spent becoming the subspecialist that they want to become.
I got to work with amazing mentors in the field who really took me under their wing and really supported me throughout the process.
Your destiny is in your hands. You have to actually decide how hungry you are and what you really want to accomplish, and we will be there to put the pieces of the puzzle to be able to actually engage and embrace whatever interest you have so we can make you successful as you come out into practice.
We've come a long way. We are hopefully in the era where we can cure sickle cell disease. We hope to continue to treat many others and hope to move this field forward.
We need a fellow who is ready to see everyone without discrimination, ready to work in a county hospital.
You feel that you are doing your best to treat the patients, and also our patients are happy to come to see you in clinic, and they are happy for the care that they have been receiving from our teams.
We want to do a good job. We want to do a good job for our patients, but we're also here to learn, and that's really evident with our faculty. They are always looking to help us grow.
Fellows are an integral part of the hospital. Seeing patients and really, making patients their own.
The attending physicians want to work with the fellows, bring out the next generation. And I think that culture is from the top down, something that inspires me to come to work every day.